This is how we brush teeth. This is how we brush teeth. La 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 la. Hi everyone, this is Dr. Milad Sharooh, otherwise known as the Singing Dentist, and I'm here in Dubai to bust some myths and misconceptions about dental care for children with Baby and Child UAE. There's a big misconception that children don't need to have their teeth brushed. Well, actually, you absolutely do need to clean them. Keeping babies' teeth clean is so important because they play a big role in the development of their adult teeth. So, as soon as the teeth arrive, make sure you're brushing them. And you can even clean the gums on babies because that gets them used to having the feeling of having their mouth touch, and it just keeps the gums nice and healthy, ready for the teeth to come through. Another misconception is that children shouldn't have fluoride. Well, I believe they should because fluoride is one of the main reasons why dental decay is reducing and has dropped over the last 30 years. It helps to strengthen the teeth, it helps to prevent cavities developing. So if used correctly, it's really good. And the way you need to use it is brush with it. Don't eat the stuff. Put it on your toothpaste, brush your teeth and use the correct amount for the child, and it has massive benefits for their teeth. Also, the amount of toothpaste you use is very important. What we recommend is from 0 to 3, you use just a tiny smear of paste. So not a lot, you just literally tiny little smear. Then from 3 to 6, you can use a small pea-sized amount. And from 6 onwards, they say double pea or just like a regular adult amount. So that's the way you should break it down for how much toothpaste you should use. I often get asked about when to brush teeth. Before breakfast, after breakfast, before you sleep. So my advice is this: brushing teeth before bed is very important. That's the important one because you need to clean all the food off, get all the plaque off your teeth before you go to sleep. So that's a definite. Then it's one other time in the day. Now for me, my routine and what I recommend is to brush when you first wake up in the morning. The reason for this is when you're asleep overnight, you still build up a lot of plaque on your teeth. So when you wake up, your mouth is full of bacteria. If you can clean all that bacteria off, and then you have your breakfast, there's just less bugs in your mouth. So that's the way I do it. But really, if you're in a big rush in the morning, you just can't get that in, brush the kids' teeth when they get home from school. As long as you do it twice a day, it's still gonna work. Some parents think that because milk teeth are going to fall out anyway, you don't really have to look after them. But again, that's such an incorrect messaging because you really do. First and foremost, if your children get tooth decay, it's really painful and no one wants to see that. And also early loss of baby teeth due to tooth decay will have big implications in their adult teeth. So please just look after the baby's teeth. We all know chocolate and sweets are no good for teeth and we shouldn't use them, but what can you give your child? Yes, very healthy dried fruit. Woo! Well, dried fruit are actually not very good for the teeth. So stuff like raisins or like dried apricots. Reason being is when you dry out the fruit, you actually turn it into very concentrated sugar and it's very sticky. So when your child eats it, it just sticks on the teeth and it's like the gift that keeps on giving. It basically just keeps the sugar on the teeth for a really, really long time. Much better to give them fruit because the sugars are then locked within the fibers of the fruit and it doesn't have so much of an effect on the teeth. When choosing a toothpaste for your children, always use the children's toothpaste. But from my personal view, I don't really like the fruity flavored ones because they're quite sweet and it can get the kids used to that sweet taste and the sugar addiction starts early, but also they just swallow it because they think it's sweet. So toothpaste for me should be toothpaste. That's why they taste kind of minty. But children's paste have a much lower concentration of the mint, so it's the burning sensation they don't like. So that's the main difference between children and adult toothpaste. And also the fluoride content. Make sure you choose age-specific toothpaste for your child. I've been the Singing Dentist, and remember, my job is to save your tooth. So brush and floss like you need to do. You get toothache, I'm here for you. I'm here to help everybody. And last night you had Vindaloo, and now your breath kind of smells like every day when you brush, scrape your tongue too. Because my job is to save your tooth. Let me start again. Big bad. Put my teeth in. I'm stuck. And sweets are bad for the teeth. So what, do you mind? I'm trying to work here. Is guys a good word or should I use everyone? Guys all right? Keep it more conversational. Conversation. Friendly conversation. Okay,